ICD-10 is probably going to affect hospitals in a complex and probably challenging way.
I think that it's going to be more and more difficult to practice without an electronic medical record.
The ICD-10, you have to be specific on every disease level.
We need physicians who, I think, understand the challenges of these new requirements.
Welcome to an overview of Dignity Health's ICD-10 Physician Education Program. Today we'll discuss the transition from ICD-9 to ICD-10 and what this change means to physicians, why a successful transition to ICD-10 is important for Dignity Health's physicians, the benefits associated with the move to ICD-10 and the ongoing importance of clinical documentation, and the work currently underway to ensure that our physicians are prepared from leadership support to online and in-person educational sessions.
We are in a phase where we're moving from volume to value in terms of the way that we're compensated and incentivized to take care of patients. Historically, in the clinics, it was more about, how much work you did in a visit to get paid for productivity. Well, in the future, as we get paid for how well we're taking care of a population, the increased complexity of our coding will probably mean more revenue for us in the future.
The Centers for Medicare and Medicaid Services, most often referred to as CMS, has mandated that all healthcare providers fully adopt ICD-10 by October 1st, 2014. The transition from ICD-9 to ICD-10 will have a wide-ranging impact on the physicians and the Dignity Health organization, touching nearly every area of business in some way. To address this, we will ensure that our physicians have the knowledge and tools to prepare for this change. The transition to ICD-10 is one of the largest initiatives ever undertaken at Dignity Health. Approximately 50 of our IT applications must be updated to accommodate the new, more complex codes. Over 85% of Dignity Health affiliated personnel will require some education and training to utilize the new code set. However, the most key individuals in this initiative are our physicians and non-physician providers who dictate and write the histories and physicals, notes, and discharge summaries that describe what is happening to our patients. Physicians, nurse practitioners, physician assistants, residents, and fellows in the acute and ambulatory settings will need to enhance the specificity of the clinical documentation to support accurate coding on ICD-10.
The structural changes of ICD-10 will increase diagnosis codes from 3 to 5 digits in ICD-9 to 3 to 7 alphanumeric characters in ICD-10. While this will provide increased specificity and information on our patients, it will result in the number of diagnosis codes increasing from 14,000 to 69,000 codes. There will also be structural changes to the procedure codes, which will increase from 3 to 4 digits to exactly 7 alphanumeric characters. The current 4,000 procedure codes in ICD-9 will increase to 78,000 in ICD-10. Physicians and non-physician providers will continue to use the current CPT codes to report professional services on their own bills for both inpatient and outpatient services and procedures.
Preserving an accurate reflection of our patient's severity of illness is critical to maintaining both physician and hospital quality metrics. Most public quality reporting organizations use observed versus expected methodologies for outcome measures that are based on chart abstraction or coded diagnoses. We must educate ourselves regarding the specificity required for clinical documentation to support the accurate coding of our patients' illnesses. And when physicians assign a diagnosis code, we must select the codes that most accurately reflect our patient's clinical status.
There are benefits that will be realized by transitioning to ICD-10. quality measurement. The increased specificity of ICD-10 codes will provide greater detail around a patient's condition, enhance the ability to accommodate new technologies and procedures, and provide better data for evaluating and improving the quality of patient care.
Research. The greater detail contained within the updated ICD-10 code set will facilitate improved, more accurate data analysis, providing new opportunities for research programs.
Public health. The United States is currently the only industrialized nation not using ICD-10 for morbidity and mortality purposes. The adoption of ICD-10 will facilitate international comparisons of quality of care and the sharing of best practices globally.
Organizational monitoring and performance. This transition will allow physicians to refine the patient data used to determine best practices, evaluate performances, create efficiencies, and contain costs. It will also allow providers and payers to monitor trends and outcomes and forecast healthcare needs.
Reimbursement. The increased specificity of ICD-10 will provide payers, policymakers, and providers with better information to refine reimbursement systems. By providing greater detail within clinical documentation, physicians will be able to capture the medical necessity of the treatments and services they provide.
Dignity Health has developed a robust program to help prepare our physicians for the transition to ICD-10. We are currently updating our IT systems and adding workflow tools to help physicians select the most appropriate diagnosis for complete and accurate clinical documentation, expanding our hospital-based clinical documentation improvement programs to assist with education and daily chart reviews, developing online and in-person educational programs to guide physicians through the specificity that is required to document accurately in ICD-10, establishing a physician champion network to help communicate and manage the educational process at the facility level around the need for accurate, specific clinical documentation that will be required in ICD-10. This educational program will deliver learning in an integrated manner with a focus on end-user understanding, adoption, and the successful application of crucial concepts. Beginning February 1st, 2014, Optum's e-learning modules will be available for all physicians. On the learning platform, physicians will be able to choose from 1 or 2 overview modules and 21 body system specific modules to demonstrate how clinical documentation will be impacted by ICD-10. Physicians will be asked to view 1 overview module and 6 clinical modules they feel are most appropriate to their practice. Many will choose to view more modules if they have a wide array of patients in their clinical practice. Most modules will take about 30 minutes to complete.
Starting on April 1st, 2014, PwC's physician educators will begin visiting our hospitals and clinics to provide on-site, stand-and-deliver educational sessions for our acute and ambulatory physicians. Sessions will run approximately 60 minutes in length. All educational sessions will be held in a classroom setting designed for small groups of specialists to focus on relevant material for each physician. Additional presentations will be developed to augment the e-learning and in-person sessions on an as-needed basis.
Our hospital clinical documentation improvement specialists will work side by side with our hospital physicians, creating tip sheets and reviewing patient charts for areas where specificity might be increased for more accurate clinical description. Our team is also evaluating smartphone applications that can quickly help a physician find documentation tips on a specific area he or she may be encountering during the course of their day.
I think Dignity Health is taking on the process of ICD-10 implementation in a very proactive way. I think they're stepping up to the plate and deciding that they have to embrace this, they have to promote it, they have to develop it, they have to support it and implement it.
And the key is in documentation in the chart, so we're going to have to be a lot more specific and include more information in our progress notes and in our diagnoses.
I think we are ahead of the game, and then we are ahead of the rest of the our competitor on this game, and I really think that we are doing much good for our physicians.
The concept of allowing physicians to maintain their autonomy but be part of something bigger is going to resonate really well with patients and physicians alike. And so I think we will be really well positioned for what's coming, and that both patients and providers will flock to us to be part of a system that I think resonates really well with people.
So, in summary, it's our hope that after watching this video, you walked away with a better understanding of how large the ICD-10 initiative truly is, with more than 5 times the number of diagnosis codes and more than 15 times the number of procedure codes. How important it is that we successfully navigate the transition to maintain our physician and hospital quality metrics, and to accurately reflect the clinical status of our patients for both quality and reimbursement purposes. An idea of the benefits associated with the move to ICD-10 and the role each of us plays as we continue to enhance our clinical documentation. And finally, how Dignity Health is preparing physicians for ICD-10 through ongoing education. We invite you to send any questions you might have to ICD-10help@dignityhealth.org or visit the ICD-10 website at dignityhealthmember.org/ICD-10. Thank you very much.